MOvember, day 22, and I'm going to talk about a sensitive subject. You'll notice I'm wearing my season 2022 Rabbitohs merch. Got it in the mail today. Had the privilege this year of talking to the elite playing squad over there around relationships and sexuality, and I was pretty proud of the club I've supported since I was 6 years old that took bold initiatives to try and support their players and staff in ways of cyber citizenship and attempts to make it a safer experience for players and to not get themselves into trouble, as some have, with betrayal trauma. So what I'm going to focus on tonight, I opened another video this month with this slide. Generally, people turn up to see someone like myself, a certified sex addiction therapist, where their life is blown up as we know it, either through work, generally through home, but a partner is discovered. There's been discovery trauma. It's revealed betrayal. It's come out through some sort of disclosure, and generally a staggered disclosure. And what it essentially reveals is a secret life. And the other day I sort of blew this up, and I'm getting used to Prezi, so I'll blow this one up again. Generally, we can have a fairly happy family home. It's been compartmentalized. It's largely been kept that way through gaslighting. But then this secret sort of toxic basement, this little tunnel that goes out to the world appears. And it sometimes comes out through staggered disclosure and trickle truth. Addicts generally only disclose what they're caught for and a little bit more. The manipulation begins, more gaslighting, of course. But then essentially what we're left to deal with is an illness and deception. Now, I went on to show more about that the other day, but today what I want to talk about is the impact of the deception. And I will do my best to present the work of Dr. Omar Minwali. Now, he talks about deceptive sexuality, and this SARD model and trauma model has come about because what we've known about sex and relationship addiction has changed over the last 10 to 20 years pretty dramatically. Once upon a time, when I first started working in treatment at South Pacific in the early 90s, we had a co-addict model for sex addiction. It's the best we had at the time. And under that guise, that moniker of codependency. And we saw it as no real difference. Since we've been able to MRI a traumatized brain and we understand attachment theory now at a neurobiological level, it's been really highly recognized that that isn't the best model for betrayal trauma. And all of us had to adjust, and new therapists coming into the field now are being taught a new way and won't have any knowledge, I suppose, unless they do sort of therapeutic history to work out how we treated it once before. Sex addicts seeking treatment must also identify the harm that they have caused. And this is the hard thing about sex addiction treatment, is people come in with that life being blown up as they know it, and with a fair bit of denial and sometimes remorse, especially if they've been caught for everything, or everything that at least in every area that they've been acting out. And if they go to treatment, the sex addiction will get focused on. If they go to an old-styled treatment centre, their partner might even be invited in for family week, and they might then take them through the process of sharing realities and letting go of resentments and all that stuff, which is really traumatizing to partners, because what we know now is, with using the trauma model approach to betrayal trauma, is that due to the attachment, the very unique attachment that happens in a love relationship that Dr. Sue Johnson talks about in her work with EFT, emotional focused therapy. What we see is this difficulty that a partner is now exhibiting symptoms that are very post-traumatic stress-like. It's not a diagnosis yet that I know of, but betrayal trauma PTSD is something I know will feature in some sort of diagnostic way in the future. But for now, we are left to help folks that walk through the door understand this. So as we've moved from sex addiction treatment, and then we've taken this trauma model, moved from the co-addict model to the trauma model of working with partners, then this really highlighted this discussion. Now, I am not trained in this model, but I'm enthusiastic with the message that we've got to learn. Certified sex addiction therapists need to be able to convey two really important messages. One is that you have an addiction. If we can assess that and identify that, then an addict will need to own their addiction. But the second thing is they're going to have to start to own the harm. So I'm going to go through and read through some of what the difficulty is for an addict to have to confront, because they've got a disease that has a criteria feature of denial. So it's hard enough to get them to own the addiction. But I've just seen too many partners, too many addicts lately coming in, doing their work, identifying the addiction, identifying the childhood trauma that drives the addiction, falling back into that childhood trauma and focusing on their own trauma work. And meanwhile, if I go back to that original slide, essentially what they get to bypass is the nuclear explosion that they've created, and the fact that now their partner is living in a house with this secret toxic basement that once upon a time they didn't know about, but now it's all they can think about. So let me, if I can, introduce you to this worker, Dr. Omar Menwali, and you can start to draw in on those resources if this matches your experience. So let me just take a drink of water. So the question here is, what is deceptive compartmentalized sexual relational reality? The majority of people who struggle with repetitive and problematic sexual behaviors and seek clinical intervention are in relationships, often intimate partnerships or marriages, have families, and may be parents as well. In fact, most clinicians working with these individuals indicate that one of the primary motivators for treatment is the impact on the partnership, the marriage, and or the family. And that's certainly true. I have people come in and it's the partner's discovered it, the partner's done the research, and in true pro-dependent fashion, as Robert Weiss would say, that they really should be celebrated when they finally get their addict partner into treatment, because they've done a lot of work generally to help that happen. So what has not been part of the focus in any of the dominant diagnostic and treatment models is that the patterns of repetitive and problematic sexual behaviors are often part of a deceptive, compartmentalized sexual or relational reality within the context of intimate relationships. So these DCSRs are intentionally hidden and separated from the rest of the person's life and reality, which has a huge negative impact on the person's family. In order to create and maintain a DCSR within an intimate relational context, a person has to violate the boundary of fidelity and corrode the conditions of healthy relational functioning. Respect, trust, honesty, integrity to such a degree that the partner often experiences psychological, emotional, and relational abuse. A DCSR involves intentional psychological manipulation of another person or people, chronic utilization of deceptive tactics. Gaslighting is the word that gets thrown in here and overused now and probably underexplained, but this is explaining what gaslighting is exactly. And an ongoing psychological and system of violation and manipulation. So tactics used by individuals in this type of situation include chronic patterns of lying through omission, and a psychological manipulation of the victim's reality. This type of deceptive compartmentalization effectively keeps things hidden from the people who are dependent on the person's sexual, emotional, relational integrity and fidelity, and forms a distinct criteria for diagnosing sexual acting out patterns as a sign of disorder. If confronted or discovered, these people will often use patterns of defending and blaming the victim or the relationship rather than assuming responsibility for the deceptive compartmentalized patterns of sexual or relational behaviors. These patterns then often cause additional psychological, emotional, and relational harm. So if I just pull in on that for a second, what that is in the lived experience of a therapist's life is that you are finally getting to a little bit of honesty about the sexual acting out, but the partner is generally really erratic. And if I was to sort of grab a model of the brain, I'll try and hold it where people can see it. So if we put that in the head just there, our frontal cortex, our executive thinking, is what an addict in recovery is largely functioning with. They've also got some developmental trauma issues generally that'll bring them to their midbrain, their fire department. But essentially, when they're dealing with their partner, they're here. And what we know is that a partner, when they're triggered, goes to their midbrain. The limbic reaction that happens that then explodes them into self-protection. They're reaching for safety. But if this deceptive compartmentalization has occurred and now starts to occur in recovery, it just has a catastrophic impact on the psychological framework, the way that a partner lives and experiences themselves. And in actual fact, if someone's really good at this, the partner can end up looking and appearing crazier than the addict. They will do things and act in ways that they would never have done if they hadn't experienced this incredible compartmentalized lying and deception. And so this can look really difficult when clients come in and the partner looks so erratic and over the top. The addict can sometimes lean back and say, look, this is crazy. Shouldn't there be some rules? And there is. Look, it's not going to be okay if a partner is physically assaulting or the addict's life, but it can be easily understood when we see that if someone is systemically hidden all of this from you, and then even in recovery, I think what is even worse is if someone goes through and pretends in recovery. I've had people come to the office, pay for the session and go and see a sex worker, but they're coming here as a smokescreen for I'm doing something about it. So what we've got here is an issue that I think is a very difficult one to deal with if you're dealing with a sex addict that's got a betrayed spouse. And we have to really confront the addict with two difficulties. One is the sex addiction that they're dealing with, and the other is this sexual relational integrity disorder that is going to destroy their family if they cannot start to own it and own the impact. Now, full disclosures really help with that, but if this isn't owned before a full disclosure, then it's not uncommon that an addict will make the decision that I think the whole truth is only going to harm them. If they really knew what I was like, they wouldn't be with me. So they'll go into a full disclosure as part of this untreated sexual relational integrity disorder. So, what is the integrity abuse disorder? So let's just have a quick look at that. The other primary criteria of the SARD diagnosis is integrity abuse disorder, which is a type of conduct disorder that is defined by a significant lack of integrity and a covert relational abuse system. The IAD is characterized by sociopathic patterns of behavior, antisocial patterns that are characterized by long-term patterns of disregard for or violation of the rights of others, deficits in conscience, deception and manipulation, impulsivity and recklessness, a lack of empathy towards others, or remorse, coupled with a disregard for social norms or moral conduct. These types of behavior patterns can lead to a repeated harm and abuse within relationships, particularly with intimate partners and family systems. So what is compulsive entitled sexuality? Compulsive entitled sexuality refers to an inability or unwillingness to control sexual urges or behaviors, even when they cause significant negative consequences. People may experience CES because of a compulsive addiction disorder and or a pathological level of perceived sexual entitlement. Indeed, many patients present with at least some behavioral control problems and sexual entitlement perceptions. So examples of CES include a lack of ability to control impulses, or a desire or a sense of entitlement to engage in problematic patterns of pornography use, infidelity, prostitution, cybersex, flirting, and sometimes this can extend into clinical concerns such as sexual offending, abuse of power in the workplace, And I think that was where it went into another slide. So the let me just take you back here for a sec. Yes, so you know, we've certainly seen this showing up in the news, and whether it be sporting teams, whether it be politics, whether it be high profile business or entertainment, where we've seen this abuse of power as it starts to come out in different areas in that person's life. So this work, as I said, comes from Dr. Omar Minwali, and it's the links for all of this are in these slides that I've got at the end. I'm not going to talk through all of these, but I wanted to put in a few slides here that are there for folks that you can look at later on. International resources for partners. So if you're in Australia or around the world, international for Australian resources that I just showed there, and some resources for addicts and compulsives that you can also look up and get the help you need. This is a very shameful area when you're a recovering sex addict to have to reach out and ask for help, and especially when we've caused harm to others. But if you are in that situation, then it is something that you can do something about. I've got our website there if you want to make contact and ask for any more direction that might have come up for you, if you've got some needs that have come up for you from this particular video. So as I said, this is a tough subject, this one. I've worked with addicts now for over 33 years in the field. I've been in recovery for 35 years, and I know personally the pain of this and the pain that it's created, and it's caused enormous injury to important people in my life. And I know when I work with others, I see the injury it causes and the delusion and denial that we can have that stops us from seeing it. So thanks for watching for this video. Please pass it on to anyone that you think might benefit from seeing it, and reach out for support if this is an area that's caused pain in your life. Be gentle with your heart. I look forward to seeing you in the next video.